If your job requires repetitive motions, for the wrist and elbow that overload your elbow, you could be a candidate for tennis elbow, even if you never touch a tennis racket. And to explain why and what can be done to lessen the pain, we're joined by Dr. Sean Riley. Hello, Dr. Riley.
Hey, Charlie.
Sean, let's start first by understanding what is tennis elbow.
Sure. So it's summertime here in Tulsa, Oklahoma, and summertime means everyone's outside, staying active, hopefully, playing sports. I'm a big golfer. I'm on the golf course. So unfortunately, with summertime and springtime, I see a lot of sports-related injuries. I see a lot of golfers' elbow and tennis elbows. Lateral epicondylitis or tendinitis to the lateral or outside of the elbow, Charlie, is going to be tennis elbow. Medial or inside epicondylitis is going to be golfers. So if you got your elbow there, the outside of the elbow, okay, that's going to be the tennis elbow, and then the inside is the golfer's elbow. And these are both typically repetitive type injuries. I many times see patients with these types of injuries that don't play golf or tennis, ironically. And it's just a repetitive type injury where the extensors of your wrist, they actually originate up there on the outside, and the flexors originate on the inside of the elbow. And any repetitive type motion of that wrist can create these type of injuries. Ligament connects bone to bone. So a tendon connects muscle to bone, okay? And many times what happens in a tendinitis type injury, there's obviously inflammation of the tendon. That tendon, if you can imagine, kind of like a rubber band, and then the muscle connects to the rubber band, I'm constantly yanking on that rubber band, and it starts to create some irritation where it inserts or connects. Better yet, Charlie, imagine tree roots into the ground, okay? Those roots go into the ground, similar to the way the tendon connects into the bone. So if I'm constantly putting tension on that tendon, it potentially creates some irritation, inflammation, and unfortunately pain where those tree roots go into the ground. So you develop a very uncomfortable type of condition on the lateral or outside of the elbow and the medial type of that elbow when you develop that inflammation secondary to repetitive type injuries.
What are some effective treatment options for tennis or golfer elbow?
So unfortunately, we see a handful of these injuries, more than we'd like to here in the clinic, especially with the warmer weather, more of these repetitive. A lot of people are being active outside. Conservative care, well, first off, diagnosis is the most important thing. We go back always to diagnosis. We need to make sure that we're dealing with a lateral epicondylitis or a tennis elbow issue or golfers. And from there, develop the treatment plan.
You mean it could be something else?
Well, potentially if it's severe, maybe a tear. Is there imaging that we need to get involved? Should we go ahead and make the referral or recommendation to get an orthopedist involved? But for this conversation, let's say it's just an acute type of an injury. They've noticed discomfort and pain over 3 to 4 weeks. It's just kind of hanging around. It's not really going anywhere.
Right.
They could maybe play, but it's still pretty uncomfortable. We're going to recommend some form of conservative care. The first thing that we would like to recommend is figure out how to reduce the inflammation. Figure out how to resolve the pain a bit. We go back to ice. Ice is one of those things. Think about a big swollen ankle. We want to use ice to bring the inflammation down, bring the blood flow down. And then the next thing is modifying activity. Obviously, we need to have a visit about what are they potentially doing repetitively that's contributing to this situation. So many times, Charlie will treat these types of conditions and we'll be tracking along pretty well. They're progressing. Things are getting better. And then it might resume the activity and it flares it up. The tendon's kind of an interesting animal in that it's almost avascular. And what that means, Charlie, is it has limited blood supply. If I were to break a bone, injure a muscle, the recovery for the most part is going to be fairly typical because there's just a lot of blood supply to that tissue. And with more blood supply, you're able to get all those healing agents in, get the waste out, and really speed up that process. Well, the tendon doesn't have a ton of blood supply, so the treatment needs to be just very kind of methodical. We need to condition that tendon appropriately. So we talked about ice, modifying activity. We have high-intensity laser therapy, a fantastic treatment option for tendon injuries. new technology that we recently added, and it is fantastic for reducing the inflammation, reestablishing the healing process, gets in there and kind of stimulates the mitochondria, reproduces ATP synthesis. All this stuff means essentially it's increasing that healing and that healing response. And so I've had a lot of really, really good outcomes thus far with the laser therapy in the clinic. We then want to maybe start doing some therapy, reconditioning the tendon appropriately. And what I'm talking about is it could be stretching, it could be loading the tendon with some simple exercises. We use flex bars and different types of therapy modalities to start to recondition it. So there's a process. We want to obviously manage inflammation early on, the different things like ice and so forth, and the laser therapy has been fantastic. I failed to mention that manual therapy, deep tissue massage is very, very effective as well for these tendon type injuries. We don't want to be working on the tendon itself. We want to go a little further downstream where that tissue, the muscle, might be a little overactive and tight. And then ultimately some form of conditioning drills, therapy, and so forth to properly get that tendon healed up.
So, you get some ice on it, modify activity, maybe some laser therapy, some massage, and then some reconditioning therapy. Is there any other therapy or process you can go through to help me recover from tennis or golf or elbow?
Sure. I speak from experience on this one, and I had a really nasty case secondary to a skiing accident, and I went through my processes here in the clinic, and I think I'm a very good example. I was very diligent with all the therapies. It wasn't responding as quickly as it could, and I actually had some steroid put into it. I had a little bit of an injection put into the elbow there that kind of cooled off the tendon, really knocked all that inflammatory process out. So I think steroids at some point might be a decent option, injections. And then worst case scenario, unfortunately, like other things, surgery could be an option. But that's why I'm so proud of what we're doing here at Tulsa Spine and Rehab is that if the patient isn't responding appropriately, even me as an example, I want to figure out what else we need to be doing to speed up the recovery process. Sometimes throughout a few weeks of care, okay, let's back off. Maybe we need to get a picture. Maybe we need to get an MRI to determine the severity of the injury. Okay, there's a little bit of a tear there. Let's get an orthopedist involved. Sometimes, many times, they refer back to the clinic. Continue on with your therapy there, with what you're doing. Other times, they'll make recommendations for maybe a steroid injection. And then worst case, sometimes there is a surgical recommendation.
I'm speaking from personal experience here when I talk about when I had tennis elbow once upon a time many years ago, when you and I were first working together, and I went to a doctor who did want to cut on me right away. And it was your advice that said, no, try the ice, try the modified activity, and go with massage and so on. And that saved me from having to be cut on to remedy my tennis elbow. It absolutely worked.
Sure. It's a tough surgery. Sometimes it is indicated, warranted, and needed in those types of things. But I think going back to many things that we do, if it's an option, a reasonable option, jump through as many conservative hoops as you can.
And that's just another example of how Tulsa Spine and Rehab keeps you moving and gets you moving with a collection of specialists providing chiropractic care and the physical therapy, massages, strength training, yoga, and now even cryotherapy. Whatever the tool is you need, you'll find it right there at Tulsa Spine and Rehab. You can sign up, by the way, for Dr. Riley's free e-newsletter. And, of course, explore TulsaSpineandRehab.com. You'll learn more about how they can help you get moving.